Welcome to The Explainer. Today we're throwing on our detective hats to investigate a condition that carries a massive, but often totally hidden psychological weight: hair loss. We're going to examine the clinical clues, track down the root causes, and, most importantly, uncover the medical solutions that actually work. Okay, let's dive right into this, because the very first question we really have to answer is whether hair loss is just a cosmetic issue. And the emphatic clinical answer? No, absolutely not. Hair loss is profoundly more than skin deep. For millions of people, it triggers a severe, often silent cycle of anxiety that fundamentally alters how they see themselves. And look, if you've ever felt unheard about your hair loss, I want you to know your experience is incredibly valid. You are not alone in feeling frustrated. Studies show that patients often perceive their hair loss as severe, yet, and this is shocking, a full 40% report feeling that their doctors were dismissive, unsupportive, or just insensitive, often offering zero tests and zero treatments. So here's our roadmap for today. We'll look at the true emotional toll, the normal hair cycle, diagnosing your hair loss, the big three culprits, and finally, treatments and solutions. Part 1. The true emotional toll. Validating the impact. The emotional distress of losing your hair isn't just about vanity. It's a documented clinical reality. When we look at individuals with conditions like alopecia areata, the data is seriously sobering. There's a significantly higher incidence of anxiety, depression, ADHD, paranoia, and OCD. And most tragically, studies indicate that 12.8% of patients actually report suicidal ideation. Let that sink in. This is a profound psychological burden, and it warrants serious, empathetic medical attention. Moving on to Part 2, the normal hair cycle, establishing the baseline. You know, every good medical detective needs to know what normal looks like before they can spot what's going wrong. Now, what's really interesting about this timeline is that the anagen, or growing phase, is incredibly long. It lasts 2 to 6 years. Then it transitions in the canagen phase for a couple of weeks, rests in the telogen phase for a few months, and finally, it sheds in the exogen phase. The big takeaway here? A shedding phase is completely normal. We all naturally lose hair every single day. The crime only really occurs when this cycle is drastically disrupted. Part 3. Diagnosing your hair loss. Gathering the clues. Figuring out what is happening on the scalp requires a super methodical approach. Step 1 is getting the details, and I mean all the details. A doctor should be asking about recent crash diets, extreme stress, new medications, even family history. Step 2 is taking a good physical look to assess general density and doing a pull test to gauge active shedding. Finally, step 3 is categorization. They need to figure out, is there visible inflammation? Is there scarring that's permanently destroying the follicle, or is it strictly non-scarring? This structured diagnosis is absolutely key to solving the case. Part 4. The big three culprits. Unmasking the suspects. So the number one suspect is androgenetic alopecia, or patterned hair loss. Notice how a hormone called DHT acts like a slow, stealthy thief here. Over time, DHT signals the hair follicles to miniaturize. It takes those thick, healthy terminal hairs and literally shrinks them down cycle after cycle into tiny, barely there vellus hairs. And as you'll see, this genetic condition presents completely differently depending on your sex. In the female presentation, we typically see diffuse thinning on the vertex and a widening of that frontal midline part, usually while keeping the very front hairline intact. But in the male presentation, it follows the Hamilton-Norwood scale, classic bitemporal recession or receding hairline, along with thinning at the crown. This huge visual divergence makes having a proper clinical eye absolutely crucial. Our second culprit is telogen effluvium. Think of this as a massive stress-shedding event. Instead of that slow shrinkage we just talked about, a huge number of actively growing hairs are simultaneously shocked right into the resting and shedding phases. And the triggers? They can be incredibly surprising. We're talking childbirth, severe psychological stress, crash diets, exposure to heavy metals, certain medications like beta blockers, or even recent infectious diseases. You might lose well over 150 hairs a day, usually kicking in about 3 months after the triggering event. The third major suspect is alopecia areata. Now, this one is basically an inside job. It's an autoimmune disease where the hair follicle essentially loses its immune privilege. Your body's own defense system gets confused, and T lymphocytes literally swarm and attack the hair bulb. This usually results in sudden, patchy, non-scarring hair loss, often showing up in distinct circles on the scalp or even the beard.
Part 5. Treatments and Solutions. Building your medical arsenal.
All right, we've identified the suspects. Now it's time to review the clinical weapons we have to fight back. But the absolutely crucial point to start with here is managing expectations. As our clinical source puts it, the main goal of treatment is to stop progression. Before we even talk about regrowth, we have to recognize that the primary victory in hair loss treatment is often just keeping the hair you currently have. Freeing that fief in their tracks, that is a huge win. To do that, we have two powerhouse medications, and they work from completely different angles. Think of them as the stimulator versus the blocker. On one side, we have the stimulator, minoxidil. It opens potassium channels, massively boosts blood flow to deliver oxygen and nutrients, and artificially prolongs that long anagen growing phase. On the flip side, we have the blockers, finasteride and dutasteride. These don't stimulate growth. Instead, they inhibit an enzyme called 5-alpha reductase. Basically, they stop your body from converting testosterone into that follicle-shrinking DHT in the first place. But hey, a quick, incredibly vital safety interruption here regarding topical minoxidil. While it's highly effective and safe for humans, you absolutely need to know this. It is fatally toxic to cats. There are documented reports of cats dying from even a tiny exposure, like just licking a pillowcase where the medicine rubbed off. So if you use the liquid or foam, keep it far, far away from your feline friends. Seriously. Building our arsenal even further, modern medicine offers some pretty incredible advanced therapies now. There are FDA-approved low-level light devices. These are helmets you can actually wear at home that use specific 650-nanometer wavelengths to stimulate mitochondria and promote growth. For females with patterned hair loss, spironolactone is a really powerful option to block androgen hormones. And then there's PRP, or platelet-rich plasma. This is where doctors draw your own blood, concentrate the growth factors, and inject them directly into your scalp to wake up those dormant follicles. Now, for cases where the follicles are completely gone, we have the ultimate surgical solution, the hair transplant. Using techniques like the micrograft method, surgeons can actually harvest healthy, DHT-resistant hair follicles from the back of the scalp and individually implant them into the thinning areas at the front or the crown. The results today are incredibly natural, yielding massive 90 to 97% satisfaction rates from patients. It's a real game changer. So we've seen the evidence. We know the emotional toll is very real. We know the biological mechanisms at play. And most importantly, we know the treatments actually work. So I want to leave you with this question. With so many powerful clinical tools available to stop the progression and even reverse it, why do we let hair loss steal our confidence in silence? You've got the knowledge now. Advocate for yourself. Ask your doctor for the right tests and reclaim your confidence. Thanks for joining me on this explainer. Until next time, keep asking questions and keep learning.